So a last-minute healthcare push, Vice President Mike Pence meeting with small business leaders in Cleveland, where he's expected to make comments this hour on the importance of repealing and replacing Obamacare. My next guest says, though, that the GOP plan doesn't fix the root of the problem. Here now is Dr. Toby Cosgrove, Cleveland Clinic president. Thank you so much for joining us.
It's my pleasure.
I mean, you're not the only one saying this. The root of the problem, the heart of the problem, really doesn't have to do with insurance. It has to do with the cost of health care. How do we battle that?
Well, I don't think there's any question about it. The main problem that we have is the rising cost of health care, and we need to have help to make health care more efficient and more affordable. It really falls into two buckets. One is that we need to have a more efficient healthcare delivery system to look after people who are ill, and that is going to have to deal with the tremendous amount of regulation we have. We've had 14,000 pages of regulation in the last 2 years. It has to do with the ability to come together as a system so we can consolidate hospitals and get the efficiency of consolidation. We have to look at drug pricing, which is our pharmacy costs went up 19% last year, and they continue to be rising way faster than inflation.
Okay. Yeah.
On the other,
yeah, go ahead. Tell me the other part.
On the other hand, we've got to deal with the epidemics that are sweeping across our country. Opiates are a major problem. Obesity, now a third of the country obese, accounting for 10% of our health care costs. We continue to have 18% of the people smoking, a problem that can be the major cause of cancer that is reversible, is preventable. Okay. So there's a lot of things we can do.
Everything you said makes perfect sense. Let's attack the first part. When you talk about bringing the cost of delivery down, you talk about the burden of regulation, which is easy for me to understand. At the same time, I feel like, so in New York City, for example, there are doctors who don't take insurance, so you treat them like anyone who's offering a service. How much is this going to be? Here's what I can pay. And you kind of agree on a price, and you bring the consumer and the provider together. It seems like when you have insurance as the middleman, all of a sudden a price is fixed that I didn't agree to, that I'm getting a discount on this fake price. It has to do with having too many middlemen and the buyer too far from the seller. Where am I going wrong with that? How do we fix it?
Well, first of all, I would say that New York City is an anomaly in the healthcare delivery system in the United States. There's very few people.
Sure, but you know what I'm saying with that example is just that if you're actually paying, you're a better steward of the money than if the insurance company's paying.
That's true, but there are a lot of people who don't have the ability to pay.
Of course.
And that is the main thing that we're talking about. 74 million people in the United States are dependent upon Medicare. And an equal number on Medicaid. And so 49% of the people in the United States health care bills are paid by the federal government. And so we are dealing with that, and those are the people who are dependent. But
how do you deal with that? How do you get the waste out of that equation? Because if somebody's using something and not paying for it, and someone else is billing the government, which is this phantom person a million miles away, nobody's focused on efficiency and cost. How do you fix that problem?
Well, here's what's happening right now. We're not being paid anymore for volume. We're increasingly being paid for value. So the emphasis is going to be on keeping people well, keeping them out of the emergency room, keeping them out of the hospital, and driving efficiencies. And that is the direction that is going on across healthcare, whether it's private insurance or whether it's government pay. That is the direction we're headed, and it's going to require time for us to make that transition. Right now, out of 2 million people that we have and that we look after, 800,000 of those are now we have risks for, so we want to keep them healthy and keep them out of the hospital. That will ultimately reduce the cost of health care for our country.
Okay, well, from your lips to God's ears, Toby Cosgrove, thank you.
You know,